Whenever the decay inside a tooth penetrates close or into the nerve, this will traumatize the nerve. The nerve can only withstand 5 or 6 traumas throughout its life. Therefore, if you have a filling whenever you're a 15-year-old, that filling will tend to last 10 years. Then you have another filling when you're 25, another one when you're 35. Each of those times there's been trauma done to the nerve of the tooth through decay, through the dentist drilling, and eventually the nerve will start to deteriorate and die. Once the nerve starts to deteriorate and die, it will be painful. It will keep you awake at night time, it will throb, and it will be sore to bite together on sometimes. So whenever that happens, you have 2 options. You either take the tooth out and take the nerve of the tooth out with the tooth, or you sacrifice the nerve of the tooth and maintain the tooth within your jaw. Depending on the tooth will depend on how many nerves there are within a tooth. In front teeth, there are 1 or 2 nerves. In back teeth and molars, there are 3 or 4 nerves. So what happens is, whenever the nerve has been contaminated or been traumatized, the dentist needs to take out that contaminated or traumatized nerve because it's causing pain or causing an abscess, and clean the whole area out. So what generally will happen is, inside your tooth you have a nerve. This nerve goes the whole length of the tooth, and what the dentist will do, he or she will drill into this nerve chamber and clean out the nerve. Once that is done, then you have an empty nerve chamber. This nerve chamber is a void, and bacteria from the rest of your mouth can contaminate this void and form an abscess. So what the dentist will do, will drill into the nerve, clean out the nerve chamber, wash it out, make sure it is sterile, and make sure it is clean. Once they have done that, then they will fill this nerve chamber up the whole way to the apex, to the top of the tooth, and they will fill that up with a material called gutta-percha. Once that is filled, then the tooth is inert. It should not give any pain within the body of the tooth. The gums may give some sort of sensitivity within the tooth, but the actual toothache will go. Whenever the nerve has been taken out of the tooth, it renders the tooth more brittle and therefore more liable to break if you're eating toffees, boiled sweets, nuts, stuff like that. So whenever you have the nerve taken out of the tooth, you will be recommended to have a crown over the top of the tooth to help hold it together, because it is more brittle by virtue of the nerve being taken out. But if there is damage to the nerve, the only choices you have is extraction or root canal treatment. So root canal treatments can be done in one visit, over a long visit. Here at Gallagher Dental, we prefer to do root canal treatments over 2 visits or sometimes 3 visits. Whenever you take the nerve of the tooth out, basically what you're doing is you're taking the nerve of the tooth away from the rest of the nervous system, and that can be quite traumatic to the other end of the nerve. So what we like to do is take the nerve out, let the tooth settle down, and then get you back on a 2nd or 3rd visit to clean out the nerve chamber and eventually fill up the tooth with gutta-percha. Each visit here at Gallagher Dental will be an hour to an hour and a half. So that is possibly 2 or 3 visits at an hour and a half, so you're talking 3 to 4.5 hours in total. Root canal is certainly not a pleasant procedure. During the treatment itself, it does not hurt, purely because you have been numbed up. You've had local anaesthetic. Afterwards, yes, it can hurt, purely because the other end of the nerve from which you took the nerve that was in the tooth, that will be traumatized and that will try to swell up. So yes, it can be unpleasant for around about 24 hours until the nerve settles down. After the root filling is done, there will be a little bit of discomfort as well. The reason being, whenever you fill the tooth up with gutta-percha, you want to fill it right up to the end of the tooth where it meets the nerve of your jaw. This will irritate that nerve, and again, it may take 24-48 hours to settle down. After root canal, you can go and live your life as you did beforehand. You can drive, you can go to the cinema, you can play tennis. If you could play tennis before, you can play tennis now. Unlikely. If you couldn't play tennis before, you're unlikely to be able to play tennis after it. Here at Gallagher Dental, we normally leave about 10 days, 2 weeks between appointments. This is in order to allow the nerve to settle down and to allow any medicaments that we put into the nerve chamber to help it calm down to work, and to allow the whole area to settle before we endeavour to do the second part of the root canal. Well, with anything after local anaesthetic, you will be numb. So especially on the bottom, in the bottom jaw. Your lip will be numb, your tongue will be numb. So if you're going to eat, have something soft, because there is a possibility of you taking a bite out of your lip or a bite out of your tongue. So we would always say have something soft, have soup until the numbness goes away. But that would be true for all procedures. Fillings, root canal treatment, extraction, everything like that. Where you're numb, it's wise just to have something soft so the risk is reduced of biting your lip, cheek or tongue. People need root canal treatment for two reasons. One is if the nerve has been traumatized over a period of years through fillings, through decay, through dental drilling, through trauma. If the nerve has been traumatized, it will start to die off after a certain number of traumas, and the pain associated with that trauma in your tooth necessitates the need to take the nerve out to stop the pain. The second reason for doing root canal treatment is to sacrifice the nerve from a cosmetic point of view. If the nerve is in the way of cosmetic treatment, then it has to be sacrificed in order to allow the cosmetic treatment to advance. This would be pretty rare, but it is also a consequence of some cosmetic treatments. But generally, the main reason for root canal treatments is because there is contamination and trauma to the nerve chamber and to the nerves of the tooth. If your root canal is infected, it will be tender to bite on. So if you put your teeth together and you experience pain, more than likely there is an infection or an abscess on your tooth. That is in general dentistry as well. So after the tooth has been root filled, there will be a little bit of inflammation at the base of the tooth where it meets into your jawbone. That is expected, and that will give a little bit of tenderness. If this tenderness continues, then you probably have an infection. Any tooth where you put pressure on it and this gives tenderness where you can't put pressure on it, or it's too painful to put pressure on it, that suggests you have an infection or an abscess on the tooth. If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gadental.com. gallagherdental.com, or you can visit our website and book online. The website address is www.gallagherdental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.